organizing this event, this webinar, and presenting me. I believe that all this information you'll hear today will help you in the future in Greece and will give you a general idea of how the public and the private healthcare system works here in Greece. I'm pretty sure that you may have heard a lot about our country, a lot about the bureaucracy. But in our office, we use a phrase that for every problem, there is a solution. So this is our way of thinking. And through this, we are facing all the problems of our clients. Chloe, thank you very much for presenting me. I will start with my presentation. So, Chloe, we're okay, right? I think
everything works. Everything works. Thank you.
So we will start my presentation from the public insurance. Of course, I would like to mention here that generally the public insurance is one of the most complicated issues here in Greece. So we'll try to give you a general idea of how it works, but because I believe that every person and every case has a lot of differences, I'd really suggest you, if you have any questions, of course, after, and if you would like to discuss this issue furthermore, it would be better to close an appointment by person to discuss this issue because it's a very complicated matter. In the next slide, you will need the requirements you should fulfill someone in order to have access in the public healthcare system. So in the first category, we have the people that they have to complete their application for permanent residence. That means that in order to complete this application, you need to have a contract from an insurance company, which will cover you to the public hospitals. So this is the first way to have access. The second category includes people who have AMCA. AMCA is the social security number here in Greece. Of course, access to the public healthcare system has the people who have worked in Greece more than 50 days. We have also the European citizens who live in Greece and they don't work, and the refugees. Now we can see here who can have AMCA, as I told you before. You can have AMCA if you are a Greek citizen who live in Greece, if you are an expatriate, of course, also if you are European people who live in Greece, and we have the beneficiaries of international protection. All these categories can have AMCA and can have access to our public healthcare system in Greece. The same is as the public insurance is for the AMCA, that it's also a very complicated issue, must be analyzed by case every time. So every issue you may have with the public or with the public insurance or the AMCA, it's a good chance to discuss it by person and to analyze it even more. So now I would like to tell you a few things about our next topic, which I believe is very important to have it here in Greece, and will give you a lot of information because it's a very important issue. I'm talking about the private health insurance. In this part, we will discuss your choices and how you can have full access to the private hospitals and generally to the private health system. Here we have to discuss a very important issue, the issue of the tax residency. The issue of the tax residency affects a lot of things for the private health insurance. Affects mainly our choices and our price. So this happens because some insurance company doesn't even not accept people who are tax resident of abroad. So first of all, we need to clarify in which country you are tax resident. Especially in cases that we have people that are tax resident of United States, we have companies that they don't even accept their cases. So although in these cases we can find solutions, we have less choices, of course, but we can still find a solution. An important information you should know is the following, that if you're a tax resident of Greece, you can get private health insurance in Greece, and you have worldwide cover insurance. But in case you're a tax resident of abroad and you get insurance in Greece, you will be covered only in Greece. This is a main difference you should know. So in both cases, even if you're a tax resident of abroad, even if you're a tax resident of Greece, you can have access to the private hospitals and the private healthcare system. But you can change the countries that you will be covered. So this is important and important information we should know and we should discuss. Now we will continue with the same topic. In our next slide, we will see the two categories of the private health insurance. The first one includes all these coverages that we can say that maybe are not so important and serious. For example, if you want to close an appointment with a doctor or do some diagnostic tests, we have the first part, the primary healthcare, which will cover you all these procedures, all these diagnostic and appointments. So my opinion is that the first part is mainly for people who wants to do this through a year and to have a general free checkup through a year. But personally, from what I've seen with my clients, the second part includes more important coverages, and we will see it below. I think that hospitalization, either for an illness or for an accident, you are covered for one-day clinic and one-day surgery. That means that you can stay into a hospital less than 1 day. You are covered also for all these expenses that you may have into the hospital. We have a coverage limit up to 700,000 euros, which is a very safe amount, a big amount for cost and expenses through a hospital. Of course, you can have full access to the most well-known private hospitals. You are covered in case you need to go to the emergency department of a private hospital, either for an illness or for an accident. Of course, it's covered the transportation to the hospital by ambulance, and we have some costs that you are covered before and after the hospitalization. We will analyze it in our next slides a little more, these two categories. Here we will see some information for the first part, for the primary healthcare. We have the diagnostic test, as I told you. Diagnostic test can be done only after your personal doctor or the doctor of the diagnostic center will suggest you to do these tests. That means that you can do it. You can go alone and do all these tests. If you have an insurance program, it has to be written by a doctor. Also, you can close appointments through the primary healthcare with doctors of all specialties. Here depends on the company and on the type of the program, how many appointments you can close through a year. So it depends on what type of program we will choose and which company. And we have the checkup. Usually, you can have one free checkup per year in all the companies, and meanwhile, you have a lot of discounts in the diagnostic center, which cooperates with the insurance company. I will pass on the next slide, and we will talk now for the secondary healthcare and how it works. Now, in the case of the secondary healthcare, we have the case of hospitalization. Here, all the insurance companies has a support center, which is 24/7. I suggest to all of my clients, before they need something or before they go to a hospital, first to contact with me, to have a connection with me, and after with support center. This way of communication, I've seen that helps also the client to not face any problem and to find the suitable hospital for their case. Depends on their area, and depends on the reason that he wants to go somewhere to a hospital. So it's very important first to have a contaction first with me, after with the support center, which is 24/7, and everything will be okay after all this procedure. Here we have the flexibility to make some coverages customized. I mean, you can choose what amount do you want to be covered in your private contract. I mean, you can choose an amount for coverage in hospital, which we can start from 30,000 euros per year, and it can go up to 700,000 euros per year. And the other characteristic that you can choose and can be customized is the hospitals that you want to take care of you. I mean, if someone lives in an area in Greece and he wants some of the hospitals that are near in their house, you can choose the hospitals that are better for you and for your family. And of course, these two characteristics affect also the price. For example, someone who will choose all the private hospitals in Greece, he will pay more money than someone that he will choose only 3 or 4 or 5 hospitals that are near their house. And the last one, as I mentioned before, it's very often before and after the hospitalization you may need is to have a few appointments with doctors or make some diagnostic tests. You have to know that all these costs are covered, and there is a specific procedure in order to get this money back, but it's not a big deal. We'll be here for you in order to finish with this bureaucracy, to have some signature from you, and to get this money back only before and after hospitalization. Now we will see some characteristics that affect the price of the private health insurance, and I will give you some examples instead. Of course, as you understand, the main information which affect the price more than the other is the age of the client. So if you have a client who is 30 years old, he will pay less than someone who is 50 or 60 years old. The next one is the occupation. As you understand, someone who may work in a danger place, they'll pay more than some other people who works in a safer, like in an office, for example. The third one, which is very important, is the deductible amount. And here I want to say a few things. It's very important to tell you that the deductible amount is the amount you pay in case you get to a hospital. I mean, we have also here the flexibility, your deductible amount to start from 0. So your company, in case of hospitalization or in case you need anything in a hospital, will cover for you all the expenses. Although we have the choices, we have the flexibility to choose through different amounts of deductible. I mean, like 500 euros or 1,000 or 1,500. And as you understand, someone with 0 deductible in their contract will pay more than someone with a deductible of 500 or 1,000 or 1,500. Of course, the number of the hospitals that we choose is a characteristic that affects the price. So it's very important to know this information. The cover limit also affects the total amount you pay every year for your contract, which can start from 30,000 and can go up to 700,000 euros. And the last one, as we told before, is the tax residency, which mainly affects our choices, not so our price. But we have sometimes if you're a tax resident of abroad, we have less choices. So this is an issue we face. And here in our last slide, we will see just the procedure for having the private health insurance. We need to follow the next step. The procedure is very easy, and we'll do it mainly electronically. First of all, I arrange an appointment to discuss your needs, to discuss your case, to see what do you need, to create a plan mainly, in order to find a suitable contract, a suitable company, which will cover your private healthcare needs. This is the first step, the important step. After of this, when we will finalize to the company, to the coverages that you will choose, we will need to fill in an application form with your personal details, of course, and a health questionnaire, which must be must be answered very carefully in order not to have any problems in the future. And the necessary documents that we will need, it's a copy of your Greek ID if you have one, or your passport. And the last one is a confirmation document for your tax identification number, known as AFME here in Greece. So when we will finalize it, after some days, depends on the company, about 5 or to 7 days, they answer us if they accept or they need something else to send them in the company from you. So generally, this is the procedure. I understand that also both of these issues, private and the public insurance, mainly the public, they are complicated things, are complicated matters, and I totally understand you if you have any problems. But you have contact me, and to help you in the future if you need anything, and to see how we can solve your problems here in Greece. So this was my presentation. If you have any questions or if you need to contact with me, Chloe is responsible for this. So it will be my pleasure to solve your problems and contact with you again. Thank you very much for attending here. Chloe, I think we're okay.
Perfect. Thank you so much, Vasilis, for your insightful and wonderful presentation. Definitely learned a lot about private and public health insurance. So we actually have a question from one of our attendees, and she asked, what is the best health insurance plan for someone who is an entrepreneur?
Excuse me, let me tell again the question because I didn't hear you well. What is the best insurance?
Which is the best health insurance plan for someone who is an entrepreneur or a business owner?
Oh, yeah. Look, this matter is something that we need to discuss it by person. Because if it's someone, first of all, we have to see the tax residency, as I told, because this affects our choices. Of course, the best thing is to have a private insurance with a small deductible. This is my choice. This is something I use with my clients, this type of clients. But generally, we have to discuss some things that it's very personal, like the tax residency. We have to do a financial plan, for example, which are the costs, which are the cost of living, which are the income, in order to see which is the best choice. It's not so easy sometimes to see this is the best company, this is the best part, or this is the best coverage. From my experience, if someone is a tax resident of Greece, EuroLife has some of the best health insurance programs in the market. And if someone is a tax resident of abroad, we have to see it by case to analyze it a little more. But generally, if I have to answer, the best solution is to have a private health insurance here with a small deductible, and depends sometimes on the clients and in other information like income, like cost, like a lot of things. We can in this kind of clients, we have to do a specific appointment to discuss these details, these issues.
Of course, understood. I also had a question. Is getting an insurance plan of private health insurance possible for someone who is a digital nomad on a digital nomad visa or permit, or do they have to be a tax resident in Greece?
No, he can. Of course, someone who is a nomad, digital nomad, he can have an insurance. If he's a tax resident of abroad or in another country, he just can have an insurance in Greece that he will be covered, he or she will be covered only in Greece. We face some issues, a few problems, because the companies doesn't cover you if you are a tax resident of abroad in other countries. So the issue with the Greece is easy. We can solve it. We can find a company which will cover the digital nomads in Greece. And if they want to have a coverage in other countries, they can go to other countries to find their and another private health insurance that will cover them there.
Understood. And you mentioned, I remember, deductible. Can you clarify what that means for the people who may not understand what
Yes,
this
of
means?
course. Of course. The deductible amount is the amount that someone pays in case that he needs to get to a hospital. So, I mean, if someone makes a cost of hospitalization around 5,000 euros, someone with deductible 500, he will pay the first 500 euros, and the rest one, so the 4,500 euros, will be paid by the insurance company. This is a way to reduce the cost of the health insurance program.
Understood. Thank you, Vasily. I think, Spiros, you had a question, so you can either unmute yourself and ask Vasily, or in the chat, you can leave it in the chat below. Okay, you're on mute, so we can't exactly hear you, but if you can leave it in the chat and let us know your question, Vasilis will be able to answer. If not, via email is also fine.
Of course.
Okay, as a self-funded retired. Okay. Okay, self-funded retiree. Okay, so I guess your question is, what is the best health insurance plan for a self-funded person who is retired? Is that right?
Yeah. I mean, yeah, I imagine that this is a question. For retired people, yes, we have specific companies that they offer for people that are retired or over an age, a specific age, some programs that they worked very well. We have also hospitals that can offer you coverage in Athens or in big cities in Greece. So we have solutions there. We have companies which companies offer access to private hospital, to the private healthcare system with a very reasonable cost. So here we have solutions. It's a company which I cooperate with, and we can have a specific appointment to discuss the choices there for the retirement and for retirement people or people that are over 65 years old.
Yeah, I hope that answers your question, Spiros. But what I can do for you is I can make the connection via email following this webinar, so that you can directly schedule an appointment with Vasilis to explore your options. And Vasilis, you do a free consultation. The first consultation is free with for the appointment. So if this is something that you would like to explore further, Spiros, this is something that we can do for you following this webinar. But thank you so much again for your question. Okay, so before we wrap up, does anybody have any more things to ask Vasilis? Beta, I know you asked a question there, so thank you so much. If not, we can go ahead and wrap up. Yeah, I would like to say thank you again, Vasilis, for being so helpful and for your informative presentation. I will follow up by email after we wrap up, and yeah, hope to see you again very soon.
Great. Thank you very much, Chloe, for this webinar, for this presentation. Thank you very much all for attending here, and I hope to see you soon again.